Are you interested to provide the best homeopathic clinical training to the students of homeopathy from the first year of the academic year? We are here to provide you the solutions regarding homeopathic education and training. We are not interested to promote any other subject but only homeopathy, and it is only feasible if we create good homeopaths out of the mass of homeopathic students. Below, we are mentioning the instructions to create clinical training from the first year BHMS students up to the internship program. If any homeopathic colleges in the world follow this path strictly, we guarantee the outcome of good homeopaths from the homeopathic colleges. Let's begin our understanding how to provide the best modalities of homeopathic clinical training from the scratch. In first year, college can arrange presentation of 100 cured cases treated with homeopathic medicines. These cases are from practicing homeopaths from the college or from outside resources. Mostly, our college outdoor patient departments have such cases. The same cases can be presented to the students of first year by the concerned homeopaths working in college hospital or by faculties. These 100 cases consist of 30% of acute cases like acute upper respiratory tract infection, acute gastrointestinal tract infection or food poisoning, acute eye infection, acute ear infection, acute viral fever, injury or trauma, sunstroke, acute respiratory infection, acute tonsillitis, skin infection or allergic conditions, etc. And 70% consist of chronic diseases like migraine, recurrent URTI, tonsillitis, eczema, ringworm, recurrent gastritis, etc. These cases must consist of history of the patients, their diagnosis with evidences and photographs, its differential diagnosis, its future complications, its general management, its homeopathic understanding, and how homeopathy work in these cases can be well demonstrated by the presenting homeopaths. If we can provide such 100 presentations to the budding students from the first year, they will develop a great faith in the medical branch in which they are learning and instigate a learning quest in them. In the second year of their study, we do the same 100 cases presentation cum demonstration with more details of the case with demonstration of clinical methods adopted by the homeopaths to understand the case and its use in homeopathic prescribing. In this year, our more focus on how to investigate a case as taught in homeopathic principles. Here, we can teach them how to conduct a case understanding process according to homeopathic perspective, to make them understand the importance of physical aspect, mental aspect, and integrated aspect of a living being. These empower them to understand the holistic view of human being and diseases process. Moreover, the knowledge of symptomatology can be demonstrated with the help of cases and their significance can be highlighted.
In the third year of study, focus can be on surgical cases and gynecological cases to make them understand the scope of homeopathic in such cases. Out of 100 cases, 50% of the cases can be surgical and 50% cases can be of gynecological and obstetrics from the affiliated homeopathic hospital or from outsources. Even at this stage, we can give them exposure to recorded video lecture on study of homeopathic medicines and its application in different variety of cases treated by very prominent homeopaths of India and abroad. During this phase, they should be encouraged to join various homeopathic online courses from authentic practitioners or homeopathic portals. In the fourth year of study, 100 cases of chronic disease with detailed transcripts of the cases for their working can be provided by the homeopathic teachers and practicing homeopaths of their area. After working with the transcript of each case, they have to submit their work to their teachers of homeopathic departments, and they will guide them to improve in their working as per subject concern. Lastly, they have to submit their work to the homeopath, who has provided the case, and he will show them the original video of the case or the original work done by him with all the evidences and follow-ups at least of 6 months, shows improvement in the status of the patient with required evidences. In the fourth year of study, the cases can be more difficult, one like autoimmune disorders, hormonal disorders, psychiatric cases, cases related to central nervous system, degenerative pathologies, congenital anomalies, brain trauma, drug addiction reversal, cases not responding to other system of medicines, or the cases require an integrated approach of various system of medicine like autism spectrum disorder, mental retardation, cancer, AIDS, etc. During internship, each intern has to take 100 cases, out of which 30% of acute conditions and 70% of chronic conditions, with transcript of the cases, worked upon these cases from diagnosis to the follow-ups of the cases and assessed by homeopaths of the college. This can be their submission to get their internship completion certificate from the concerned homeopathic college. During this phase, they have to do presentation of their 10 cases in front of all other interns and the final year students to ignite the spirit of sharing and learning. During this time, they should be permitted to attend any number of seminars, webinars, online courses outside the college premises. This will expand their vision of homeopathy and will learn from other resources. This 5-year of clinical homeopathic exposure can prove to be revolutionary for any homeopathic student to become a competent homeopath to serve the society. Here, this concept is based on clinical exposure to each and every student to homeopathy only. When we suggest 100 cases means 300 hours in a year or 265 working days, 365 days in a year. In our opinion, many theoretical topics can be demonstrated with the help of practical clinical training through case presentation in their applied form. This is more effective and productive in all sense. Let's begin our attempt to provide a better learning experience of homeopathy to all with due respect and cooperation from the authorities of the college and government. This year of 2024, on Dr. Samuel Hahnemann's birthday, we promise ourselves to do the best for homeopathy around us and make a positive attempt to do the centrifugal action of our intentions to create the best homeopathic environment for our future generation of homeopaths. We sincerely request all the homeopathic college to adopt this formula of homeopathic clinical training to make the best homeopaths from your institution. May God help us to evolve to help the sick. For more information, you can visit sambednaclinic.com or write us at homeopathiclearningavenue@gmail.com.